You're listening to a Scene Magazine special episode of Political by Design, where we unpack the stories and strategies that shape today's politics. My guest today is Dr. Sam Hall, a GP and until recently a partner at WellBeing Brighton, the home of the Trans Health Hub. In today's episode, we are going to explore the pressures facing clinicians, the impact of the Supreme Court ruling on biological sex, and what these changes mean for the future of trans healthcare in the UK. Sam, thank you so much for your time, and thanks so much for joining me here at Political by Design. We're going to talk about a lot of issues today, but before we dive in and sort of look at what's going on with trans healthcare in the UK, I'd like to give you the opportunity to basically introduce yourself.
Thanks, Leslie. Pleasure to join you this afternoon. So my name is Sam Hall. I'm a GP in Brighton. I think quite a lot of listeners may know of me or possibly even be patients of the surgery where I work, because there are, worked until recently, 25,000 patients on the list there, and 2,500 of those are, so 10% of the patients are trans and non-binary patients. We've built up a service at WellBeing, this practice, over the last 5 years, with funding from NHS Sussex, who have been hitherto very supportive of trans healthcare and our model, which is really flying in the face of traditional gender clinic system that we're stuck with in this country. A little bit about myself and my background. I'm in my mid-50s. People say I look younger. I feel older. I have 3 grown-up children. I transitioned quite late in life, in my 40s, with young children, which was a very difficult but liberating journey. My career as a doctor has spanned all of that time. I qualified in medicine in 1993. I became a consultant anaesthetist and worked in anaesthetics and intensive care for the first 20 years of my career before becoming a GP in my mid-40s. And that change of career was partly due to my experience as a trans person within the NHS, witnessing firsthand and experiencing firsthand the healthcare that is offered or isn't offered to trans people. And I guess it felt to me like a very holistic transition. My career changed as well as everything else. And I certainly found in general practice a way of being in medicine which has been liberating for me, much more focused on individual patient care, bodily autonomy, the importance of consent, all the things that ethically I believe are right about medicine I've been able to do in general practice, and particularly in the arena of trans healthcare. I think that's probably enough about me personally, and I've also threaded in a bit about what I do there. So I'll let you ask me questions. Otherwise, I'll just keep talking.
No, I mean that's great. I mean we want to hear you talking, so that's phenomenal. You touched on so many things already, and you touched on why you became a GP. Maybe to elaborate on this a little bit, because I mean, especially for people who are outsiders, who don't, who are cis people, don't require trans healthcare. Could you give listeners an idea, sort of what inspired you to actually do that step? Because I mean, some people might think everything's okay, and there are no gaps, and happy days.
Yeah, well, everything's not okay, Leslie, and it hasn't been okay for a long time. The history of how medicine for transgender people, or trans healthcare, as I call it, although others may not find that term familiar, is littered with prejudice, unfortunately, and this stems ultimately from the idea, as with homosexuality in the last century, that trans people somehow have got something wrong with their brains. It's a mental disorder if you think you're in the wrong body, and I would say that a lot of people's thinking stops there, because it does sound like a mental disorder if you think you're in the wrong body. But what's missing from this wider conversation, and it is a very big conversation, isn't it? That's not being had. It's not being had in the nuanced and sensitive ways that trans people need it to be had. It's being had from a stance of we don't exist, right? So we've got a situation now where there is a healthcare system in this country which is expensive, harmful, predicated on mental health assessments, and ostensibly trying to talk you out of being trans, and only allowing you to have treatment if there appears to be no other option. So that's what's going on within the healthcare system. And then in wider society, you've got this growing conviction that trans people don't exist, right? And I think that's a really important point to understand. It's taken me a long time myself to understand, because what happens in my bubble, which obviously includes people who know and love me and see me as a trans person, they say to me, I don't understand what gender critical people are thinking. And I said, well, I think we do need to dig into this being presented as a belief, because it is a belief. It's a belief that trans people don't exist. But trans people not existing can't be reduced to statements like, you cannot change sex. Trans people aren't asking to change sex. We stopped using the word transsexual a long time ago, in fact. We use transgender for a reason. It's gender that we want to change. And that changes the whole focus of the conversation, right? As it should, because common ground for us, regardless of our beliefs, i.e. Assuming you believe that trans people exist, as do I, because I am, otherwise I'd be negating myself. If I'm talking to somebody who doesn't believe that trans people exist, then they're looking at a woman who's done dreadful things to her body because she can't accept who she is. So there's no conversation to be had with somebody who doesn't believe I exist. What people who are gender critical need is some kind of conversion, of a change of their beliefs, and that's what I had to go through myself as a trans person when I realised, that I was trans, which arguably was not until my late 30s, because we didn't have the language or understanding when I was a child in the 1970s, 80s. I had to have that conversion to understand that trans people exist, because this was my very lived experience, this overwhelming sense of being seen as female in the world, that was really, really harmful to me and had been harmful to me since childhood. But why was I seen female? I was seen as female because somebody looked at my genitals when I was born. It's the first thing we look at when a baby's born, and put me in a box. They put me in a box, and the box is called gender. The genitals are not called gender. The genitals are called other names. But the box that I was put in was one of two choices, the pink one or the blue one, or we can give them different colours in different centuries. But what I think the underlying issue here is that we're not talking about the harms that applying a gender to a body does when a child is born, right? Because it comes with much, much more than denoting what your biological or reproductive sex organs are or look like. It comes with expectations about how you'll behave, what you'll wear, the sort of language that will be used when you're being spoken to as a child, the kind of things you're encouraged to do or not to do. And although we fight against these, and feminism has been fighting against this for decades, the fact remains this fight is being conducted within the confines of two very, very rigid boxes that children are being put into.
This is really interesting, Sam, because and I'd like to obviously this is something we're going to talk about later in more detail, but I'd be interested if you agree with me on the following. I remember, and that must be, it's been 15 years since I've seen, before I moved to the UK, in German television, it was a talk show, and they had over Kim Petras, now known as a very prominent singer, globally famous. And back then, she was known for being born in the wrong body. And there was a huge discussion nationally, but that all came from a place of compassion. So I almost feel, and you spoke, I think you said, you need a conversion. I almost feel like that people were in the right place 15 years ago, and something happened. And I'd be really interested to know what on earth happened to that discussion I remember, which came from a place of compassion. I can't recall, or maybe that's just me because I'm a gay man, but I can't recall 15 years ago the amount of sort of gender critical, the word wasn't even a thing back then, or the term, and I can't remember huge amounts of transphobia. So where's that coming from?
It's really interesting, isn't it? I mean, phobia itself, the Greek word, translates to fear best in English, and its opposite, philia, translates to love. So, and I always, whenever I think about how discrimination kind of can escalate, I think about these two opposing forces. I would say that deep within the trans discourse today, and especially amongst younger people, that the rejection of the gender binary is the key here, and that is an evolution of human thinking and consciousness, that what we allow to separate us, and we can look at myriad examples of how we other each other in the interests of, my tribe punishing another tribe. We don't need to go down that rabbit hole, but the single biggest divide that affects humanity today is the gender divide. Now, we can be really reductive and biological about it and accept that, of course, we have, matching biological reproductive features, and some of us you choose or don't choose, but use those to create new ones of us. But we don't have to be so beholden to our biology that we actually rigidly define and divide humanity into two halves, such that there's always another side. And for me, this is, the breeding ground for misogyny, misandry, toxic masculinity, homophobia. All of these things need to be thought of as instruments of gender oppression.
That's interesting because, don't know if you agree, but how I view it, at least as, someone who just recently really, I've always been fighting all my life, basically, since I turned 18 for LGBTQ rights. But just recently, took this to another level when I became CEO of Bright Community Foundation, really to do that for a living now.
Great when you can do what you're passionate about for a living.
Absolutely, and this is man. I wouldn't trade this in for anything else. I certainly think that gender as such is something that has been quite fluid over the centuries. We sort of redefine gender in so many times. And it seems like there's like a deliberate misunderstanding sometimes when people deliberately talk about the the wrong. You already said the whole purpose is to change gender if you feel you're on the wrong body,
or more really,
and not change sex.
More
right?
really to be seen differently in the world. So I think one of the things that I understand, and I think many trans people would share this understanding, is what really makes life difficult if you're trans is other people putting you in the box that doesn't feel right for you. You may rather be outside of all the boxes altogether, and more young people are coming out as non-binary. They're saying, I don't want anything to do with any of this. So it's about how you're seen in the world. And, for me, the masculine attributes that testosterone gave me meant that my voice broke. It's still quite a high timbre, but generally I am perceived as male when it's accompanied with a hairy face. And, I present as male and arguably did when I was still female. My body was still running on female hormones. I was still presenting as a very masculine woman. So this was just an additional layer of how I need you to see me to feel comfortable in the world. But the reality is, as I said, when you explore younger cohorts of trans people, or some people would describe themselves as non-binary and not trans. What they're saying is, I reject gender, the notion of gender, the idea that it dictates me, how I should present, what I look like. So this idea of gender fluidity and gender nonconformity, as you say, has always been around. And I think what's really also important is people, 30 years ago, trans people were describing what they were experiencing as, I'm in the wrong body, because we didn't have the language or understanding. And we've journeyed within the trans community that all trans people will have their own measure of understanding as to what's happened. Some very little, others will have fortunate like me, been able to afford psychotherapy, or perhaps be better educated and able to digest some of the harder reading around this stuff that opens our eyes to the fact that gender itself is a performative thing. It's an agreed societal construct that we apply to bodies. And there are, unfortunately, and I always use Love Island as my example, we're constantly being shown what's normal for male and female bodies and male and female presentations and behaviors, right down to, whether you put things on your nails and face, or not. And then there, of course, there's a huge spread of expression of gender that defies all of those norms. And we see that much more in LGBTQ plus circles, I would say, than outside of it. But there's a real, a real legacy of playing with gender in LGBT circles that we really need to keep leaning into and trust that actually the lines will blur between T, G, B, Q. In fact, the word queer is being appropriated everywhere now in ways that I think is really lovely, because it just, to me, can be applied to, anything from how we present, how we see the world, to non-binary computer coding. And queering things is what we need to do, because we are, by definition, with the rigidity of the gender construct, as well as many other constructs that apply that we don't have to do if we don't want to. We need to learn to play outside the rules in so many ways as humans, because we've restricted ourselves and presented ourselves with something that, an image of normality that is made up.
I mean, for the most part of my life, and I've always identified as a cis man, but the part man really gave me a hard time for a long time, because I'm not super camp, but I'm also not in a sort of straight defined way manly. So I always struggled to really say I'm a man. I always had the idea of basically for the rest of my life I'm a boy. Because that seemed more appropriate than calling myself a man, because I struggle with that definition of, heterosexual, non-emotional, football loving, sort of, never been me. But yeah, this just as a side note, we got massively ahead of ourselves, because I actually wanted to ask you many more questions about you personally before we zoom out. So we already touched on you being a GP, and you do that because you are passionate. I think this is already what's quite visible to listeners / people who watch this on YouTube. But something happened, right? So at the moment, it's a bit difficult.
Yeah.
So you were a partner at WellBN.
That's right. So I worked at WellBN since I became a GP in 2019, and obviously I was landing in general practice when COVID hit, which was probably to my advantage because I didn't have any kind of legacy ideas about how general practice could or should look. And COVID brought along, I think, in so many areas of our lives, professionally and personally, huge changes, many of which have remained. And some of those changes, which were happening on the ground as we navigated a global pandemic, were really great tools for for driving different models of delivering healthcare, including online appointments and text messaging that's not one way anymore. So I had a field day in COVID as a new GP. Being able to be innovative. I was very thankful to be working throughout the pandemic. I know for many people, the not working was probably the most traumatic thing, although it's also changed the way a lot of people have worked. And all alongside this, at the beginning of COVID, because I knew that the gender clinics were already massively struggling with waiting lists, people were waiting upwards of 5 years ago, and the waiting times are now much longer. There was an article in The Independent this weekend actually referring to the 42,000 people on waiting lists for gender clinics. And I recognised 42,000.
Goodness.
So
Okay.
I recognised, having really not planned to do this, I recognised that at the beginning of COVID that not only was trans healthcare in disarray, but I had landed in a surgery that was very trans positive with a reasonable number of patients on the books, about 60, I think. And my colleagues had actually sought to employ me because they knew I was trans and they thought it would be helpful for the community to have the assurance of somebody with lived experience providing healthcare for them. And so we opened up then an outreach clinic in COVID, which was really about helping other patients perhaps talk to their own GPs about treating them ahead of being seen in a gender clinic, as I was. And this was all done with guidance that had been issued by the General Medical Council some years earlier, suggesting that GPs might want to plug this gap and that it wasn't rocket science to do this medicine. So the practice where I started working had already begun this work, and I picked it up. And of course, I didn't expect it to sort of snowball in the way it did. But of course, they were right. As soon as there was a doctor who was trans, patients did feel safe, and it did change the dynamics inside the organisation and make it a safer space and more accessible because I was there. So our patient numbers started to grow quite quickly, as did this outreach clinic that I was doing. In the outreach clinic, all I was doing was asking other GPs if I would write a letter on the behalf of the patient to say, this patient would really benefit from hormones. This is what I would recommend. This is what I would do if they were my patient. And I would say, I had a very, very small hit rate with that. The odd GP would come back and say, thank you, I'm really encouraged by your suggestion, and I'm going to go ahead and do this if you'll help me with the monitoring and learning how to look after this patient. So we had a few small successes, but for the most part, I got really horrible replies or none at all. And so what happened then was that patients started to leave their GPs. This was mainly Sussex-based, but there were some from elsewhere in the country. And again, because it was COVID and we had electronic prescribing systems that allow us to send prescriptions anywhere in the country, people were in lockdown at home. It didn't matter to me if you didn't live in Brighton. I was happy if you wanted to join us as your GP, then we could prescribe for you. So the patient population started to grow quite quickly when we opened our doors geographically. We later had to stop that because I realised that there was an almost unstoppable flood was going to come through the door. And of course, we didn't have funding for this other than the £95 per annum that a GP gets for any patient registered on their list. So we didn't have enough money, but at the time NHS Sussex were looking at commissioning a pathway that would allow us to attract payment for doing trans healthcare. That took a couple of years to get into process, but landed finally in 2022. And what that meant for us at WellBN was that we could charge NHS Sussex for the care of our trans patients. And that's when our numbers started to really balloon, because we were able to hire more staff to help the team and actually grow the service inside WellBN to the point where we got to this year with, as I said, 2,500 patients, many of whom are registered with us as their GP as well. But a sizable number have a GP elsewhere. And we see them in the so-called outreach pathway. So we're basically looking after their trans healthcare. Their GP does everything else. And that as that whole cohort and service grew, obviously, I think one of the really important facts to just get straight here is I will not, as a transgender person, discriminate against another transgender person on any grounds, and that would include age. So there was never any time when I wouldn't see young people. We didn't advertise as a clinic for young people, but if people came to us or parents came to us who were under 18, I would not turn them away. That would be discriminating. So even though NHS Sussex have funded the service for over 18s, we have always, within that service, seen under 18s. And originally, I only had somewhere between 10 and 20 youngsters on our list, and they had all been seen at the Tavistock and Portman Gender Identity Development Service that was closed down last year after much scrutiny and legislation and all the other things that we can discuss if we have time. But so I'd never initiated any treatment for young people. But when I started our service and got my insurance sorted out, my insurance was to treat 16 and over, which I felt was really reasonable. 16 is widely regarded, even though it's not the legal age of adulthood, widely regarded in many arenas as an age where you can consent. And importantly, we give hormones to under 18s all the time in the cis female population. So to deny hormones to a young person under 18, but just because they're trans, that would be a moral injury to me. So I've never been prepared to discriminate against trans youth, but the NHS is, and they are, and they have been, and we've watched this unfold over the last few years, haven't we? From the Kira Bell case to the closure of that service that I described, the opening of new services which don't offer any medical treatment at all. They're still saying they're going to do a puberty blocker trial, but that hasn't even started as far as I'm aware. And of course then a legal ban on the administration of puberty blockers. Now, to be clear, and when it comes to puberty blockers, Leslie, I don't have a problem with them not being available. There are other much safer ways to suppress and deal with your hormones in your teens so that your puberty isn't distressing. And that is literally all we're talking about here. So all the fuss out there in mainstream media and amongst gender critical circles about children being damaged, children being irreversibly altered, children's lives being changed, children being mutilated, none of that is happening in our service, and I want to make that absolutely clear. We use drugs that are completely reversible. We are talking about something as simple as the contraceptive mini pill, which we give to girls all the time to help them manage the unwanted effects of their pubertal hormones. In other words, painful periods or other problems with the menstrual cycle. That same pill works if you're male-bodied to suppress your testosterone and your sperm production. It's contraceptive for men as well.
Sam, there are so many things I want to come back to, but probably the sort of the main thing, because I mean, you talked about your time during COVID, basically open up the service to many more people who need the service, who probably don't have the infrastructure in other parts of England. I think you mentioned over 40,000 people on the waiting list, which is an astronomical number. But now you're not part of WellBN anymore, and I'd like to sort of just ask, what happened there? What were you forced out? Have you resigned? We had so many different, chatter is basically all over Brighton and Hove. So
yeah, it's
I'd like
quite
to
a complex
know more.
situation, Leslie. Essentially, GP practices are run by partnerships generally, and partnerships are a self-employed arrangement. So you work with a number of other people who agree to be partners. It's a profit-sharing business venture, and you can drive changes in healthcare if you're a GP partner, which is why I became one in 2020 and how we got this service set up. I also did resign from the partnership with 12 months notice in September last year in order to progress with setting up a limited company, which I felt was a safer and better business model for the practice, and in particular for trans healthcare, because of all the persecution that we've experienced over the last 5 years. We've had 3 or 4 CQC inspections, multiple anonymous complaints to the GMC, to NHS England. I've been investigated myself on multiple occasions, never found wanting. My practice is not illegal. My practice is not against good medical ethics or good medical practice, the standards by which the General Medical Council assess me. I am a good doctor and a safe pair of hands. And one of the things I think that's really important for people to understand is, because this model has built up in primary care or general practice, and that's how we talk about the NHS: primary, secondary, and even tertiary care, which the gender clinics are considered, right? They're so specialist that only NHS England can control them, can give them the money they need. But they are controlling and giving money to gender clinics that are predicated on this antiquated mental health model. So people come to harm even setting foot in doors of those clinics, and they come to harm before they set foot in the doors because they are on waiting lists for 8 to 10 plus years. And in my view, NHS England has, since it began as an organisation itself in 2013, been set on destroying trans healthcare the way it has been done traditionally, which is fine. I am happy for those models to go because they're not healthy for people, and you shouldn't have to prove that you're trans or jump through psychiatric assessment hoops to get there. You should be allowed to do things to your reproductive organs and to your body based on an informed consent model, which is what we do. So we talk about the risks, the benefits. It goes something like this. Leslie, you're struggling with gender incongruence. You might feel more comfortable, you think, with some estrogen on board. I'm prepared to prescribe that for you. You need to understand what the risks are and then help me to help you keep your body safe. Our service is based on no gatekeeping, on your bodily autonomy, your right to choose, your reproductive rights. What you do with your reproductive organs should be yours and yours alone to decide. And I don't care how old you are. We won't do anything irreversible until you're in adulthood. We never do anything irreversible until you're in adulthood and you're making an informed decision about surgeries, for example, which, by the way, nobody goes into lightly. Surgeries are hideous. People, do them when they feel like it's going to make a difference. It made so much difference to me, to even after having 3 children and breastfeeding them, to be able to walk around the streets without a binder on and to be able to go swimming in a pair of swimming trunks, because that's what I've always done or wanted to do. These things are personal choices and they are never made lightly, and they're never made in childhood. So using trans children as the sort of litmus test of how to rile up public, anger about this is really sickening. It's sickening because these are kids who are extremely vulnerable and parents who have been trying to protect them. And of course, the other thing that's happening at the moment, which is tragic to watch, is the sheer degree of shame there is around having a trans kid. Again, think back to maybe what it was like as a parent in the 80s when your child came out as gay. People were ashamed. I think many parents today wouldn't feel ashamed if a child comes out as gay, but they do if a child is trans.
I think we basically relive the 80s and 90s, what gay people experienced in the 80s and 90s is basically now
what trans people
lived reality.
I think that's right, but there's an added layer of danger here, which I would say can only be seen if we go to very specific era for gay people, and that's when HIV and AIDS started to hit, which is the withdrawal of care from medical establishments due to prejudice or discrimination. That is undoubtedly what we saw and why it was such a catastrophe, and it still remains an issue. And again, here, we cannot expect our NHS, which is, palpably racist, clearly misogynistic. Why would it not also be homophobic? We know it is. Why would it not also be transphobic? It certainly is. And the danger here is that the interface between your healthcare needs as a trans person and that transphobia that comes at you from your monopoly provider healthcare system. It's not like you can go to Aldi if you don't like Lidl. The NHS is, for many people, the only healthcare system they've got. If you can't even cross the threshold without feeling hostility because people refuse to honour your pronouns or use the right name or say something careless in front of you, then and you certainly can't access the kind of care that you might really need, whether it be help with your hormones or reproductive organs, as we've discussed, which, by the way, many people don't need. They just need to be seen and validated and visible. And that especially applies to non-binary people who, as I've implied, are a growing cohort. So we've got a problem here where the healthcare system as a whole isn't safe for trans people. There's the healthcare that is being invested in is predicated on an old-fashioned model, and under cover of COVID, something new and exciting that is based on informed consent and bodily autonomy and doesn't require people to jump through hoops. Some of our patients go on to hormones and come off within a few months or years and go, actually, I don't want to do this anymore, or I've had the changes I want, I've grown breasts or my beard's grown and I don't want to take hormones anymore. Just allowing a little more looseness and freedom around this edge where gender and sex meet is really, really important. And we are seeing harm reduction, better mental health, fewer people going forwards for surgeries. All of this is being threatened now because NHS Sussex are doing an investigation into the children that we've treated at WellBN. And as I've explained, no illegal prescriptions, nothing irreversible. We do have a number of children on puberty blockers because if they were already having them before the ban, NHS England advised these families to find a GP to prescribe, which I did in child's best interest. I wouldn't take someone off a puberty blocker, but I do have alternative treatments for people who can't get them anymore, which we are doing. And as I mentioned earlier, I don't initiate any prescriptions for anybody under the age of 16. But if a child comes to me from the private sector with a hormone prescription, and the parents say we would prefer to be looked after under the NHS, again, I'm not going to stop a prescription. If it's in the child's best interest to continue, I will. So I have practiced good medicine, and I would argue that there isn't another GP in the country who is practicing good medicine on the grounds that they will not treat trans kids, and trans kids are dying.
Your described lived reality differs a lot from what you hear in the public discourse. It seems like the public talks about a non-existing issue. If I listen to you,
yes, I would agree.
Is what would you say from your perspective is like the biggest sort of public myth?
Well, I think. Let's go back to do trans people exist, right? If you have to examine yourself, like really examine yourself, Leslie, ask yourself the question, do I believe that trans people exist? And by that, I mean, never mind the treatments, the surgeries, because trans people have always existed and we have existed in times when these kind of treatments weren't available, right? So where we've got to now is, if you don't believe that trans people exist, then what you're seeing is people who have gone mad, doing things to their bodies they don't need to do, defying the natural order of their biological destiny, which is, to to behave like animals and obey our reproductive urges or our needs to reproduce and single that out as the most important thing we could be doing as humanity, when actually one thing we could be doing as humanity is stop, because there are way too many of us on this planet. I think the problem we've got is that if people don't believe we exist, then of course we shouldn't have treatment, and of course they want to protect the children from harm, because they don't see trans people. They can't see us. It's like Father Christmas. If you don't believe in him, you can't see him.
I really hope this reaches people who are in that grey zone, because I feel and please disagree if you feel I'm on the wrong track, but it certainly feels like at the moment there's a lot of shouting going on, and I feel people don't listen to each other anymore. So I feel we could solve so many of these myths and wrong ideas and this sort of, the public talks about something that's not actually happening by just listening to each other. But
it's hard, isn't it? I mean, I agree with you completely. Although I think, as you know, I made a video for Trans Pride a couple of months back, which is available on YouTube and has been seen by people who are gender critical. And I know from the comments they've made that they just listening to me talk doesn't do that conversion thing that we're talking about. So there is no solution other than to know and love trans people. I think that's what gives you the conversion, or an experience such as you described in Germany some decades back. The trans discourse is moving on, and it's moved on from I'm in the wrong body, from the binary sex change of the 1980s and 90s. But that's because we've moved on in our understanding of ourselves as humanity, and we just need to stop being stuck in past loops of thinking. One of the things I think is really important to understand is that the desire to transition across the binary, which I definitely experienced, is only there because the binary is all that's presented, right? So the early gender clinics are, go something like this. Okay, so I believe you when you say you're in the wrong body, and I'll help you to change. This is how you do it. A woman has to have a vagina, so you need to go and have this surgery. Or a man has to have a penis, so you need to go and have this surgery. Now, trans people all over the world, I would say, well over 50% of trans people don't have genital surgery, because we know in our heads that what's between our legs isn't the problem here. The problem is the box you put me when I was born, and I can't live in it.
You touched on the puberty blocker ban, which I think was initiated by the previous government and seen through by the current one. And it feels to me that this has initiated almost like a domino effect.
I think so.
Of, we've seen the Equality Commission then taking up that piece of work after the Supreme Court ruled on biological sex, which was, if you ask me, a bit of a non-ruling, because it didn't rule anything new. It just, sort of said, well, those are the realities around biological sex. Surprise, surprise. But it sort of inspired the Equality Commission to come up with that interim guidance, which went much further than the actual ruling. And now we're in a I think a really dangerous space, because the code of practice, after I think the public consultation was carried out in spring, is now being debated by the government behind closed doors. So what is, because I know there is a lot of confusion what the guidance is or isn't, and what probably the implications could be for trans people, for businesses. So what's your take on this?
I'm just going to pick up, just going back to the puberty blocker ban, as you said, because I think it is interesting. At the time, I felt very strongly that, especially for trans youth, because of the state of trans healthcare and no one being seen anyway, so even before the blocker ban, children weren't being seen. So they were getting through their puberties without help. And very few were actually accessing these medications. But at the time, it felt very much like the puberty blocker, how it's presented publicly is how you transition. And for young trans people, hearing that those blockers were banned was the same as hearing you cannot be trans. So it's very annihilative. Now, of course, you can be trans without puberty blockers because we've been trans for centuries and we haven't always been able to have medical treatment, and there's no right or one way to be trans. The fact of the matter is the trans experience is real. So I come back to what's going on with the Equality and Human Rights Commission and this new guidance following the Supreme Court judgment in April. I feel like what's going to happen is we're going to tie ourselves in knots because this is a category error in the law that I think has actually taken away trans rights already. We haven't seen the outworking of it. And I don't know, but I do think that the Gender Recognition Act, which came into being in 2004, which was, very much ahead of its time at the time, but now even trans people would say is too binary, too restrictive, which is why we were pushing only 5-6 years ago for self-ID, as is possible in some countries. But of course, what we really need is the non-binary option. The no gender marker or something other than that. And we are going in the wrong direction for any of that. We are going backwards to let's define this binary really rigidly. Well, let's use our sex organs to do so. Whether you've still got them or not doesn't matter, because that's the only way we can keep these two sides apart. It is a divide and conquer mechanism that's recognizable world over and historically works to, separate people and divide, and it's working really, really well. Now, where that's coming from ultimately is anyone's guess, but it does feel very much aligned with, whiteness, with Christianity, with some of the supremacist thinking that we're seeing. Trans people are zeitgeist, this decade's people to hate on, and if you can annihilate us in any way, then you will. And whether that's withdrawal or denial of healthcare, whether that's withdrawal or denial of legal rights that have hitherto been won, such as turning over the Gender Recognition Act, which I think is entirely possible, or indeed rewriting the Equality Act, which gives protections, although I'm not sure that the Equality Act does protect me anymore, because if I bring any action under the Equality Act, then surely someone's going to say to me, well, we're going to treat you as a woman for the purposes of this, because under the terms of the Equality Act, your biological sex trumps everything. I don't know. I may be wrong, but I think the fact that this is... I hesitate to say it, but for about the last 3 years, what I've seen is high-level planning across public bodies and institutions, so that newspaper articles are being published at the same time as reports are coming out, at the same time as conferences are being held. In other words, there is what I call a cabal of gender-critical people. And Kemi Badenoch gave herself away by talking about this last year in the wake of the puberty blocker ban. She made a comment about having put the right people in the right places at high level. So, there is a very concerted effort to deny trans people's very existence by writing us out of public life and using the law to do that. So I think this is all going to get a lot worse. In fact, I think we're a lot further along than we thought we were.
You said something which I want to pick on, because I think you mentioned that what could be a possible dangerous outcome is to rewrite the Equality Act. I think, to be honest, from my perspective, because during my time as city councillor, obviously as councillor, you don't get to define the Equality Act. You have to follow it. But I noticed so many times where the Equality Act is contradicting itself in the most bizarre way, and same as the Gender Recognition Act from 2004. I think the 22 Equality Act was visionary back then. It was really something to celebrate. But now it's 2025.
Yeah, we've moved on.
And you know what? I think it needs reforming. Absolutely,
yeah,
it does.
I agree. And I think, the issue of, like, if we can just get away from the very binary thinking around medical transition, the fact that people want much more nuanced care, they don't want necessarily to have surgery. Some do. It's particularly common for people to need top surgery if they've grown breasts and they're not comfortable. But, some of the treatments I'm giving are stopping them from growing breasts in the first place, so they don't need surgery, and then they can grow them later if they want to. So, the stuff that we can do and should be able to do medically, that fire needs dampening down. It needs to be put out altogether. People need to stop panicking about it. Trans people need to be truly brought under the umbrella of LGBT and, the whole queer movement, which is, and I know that young people younger than us, they're even coming out as gay feels reductive, or coming out as a trans man feels reductive. They're rejecting sexuality and gender in any form of binary nature. They just want to be free, to be who they are, to love who they love, and be seen, to be visible in the world comfortably. And if that means fiddling around with your reproductive characteristics to do so, then they should be free to do that. So, all of this freedom that we seek, it isn't going to happen anytime soon, is it? Because a rewrite of the Equality Act would be great, but I think it's much more likely that GRA will go, the Equality Act will be rewritten, but gender reassignment will disappear or be changed, or become more rigid in some way. And indeed, I think it's possible that we may withdraw from the CHR, which would be a tragedy, because where we're going in terms of human rights in this country is really quite scary already. There's a national index published by United Nations on children's rights. It's called the UN Kids' Rights Index. And they look at all the countries in the UN, 191 or 2, and they assess the countries in different domains, things that you might think are applicable to children, access to healthcare, education, clean drinking water, etc. There's a domain that looks specifically at whether this country has an enabling environment for the rights of children. There's a very specific domain. And the UK, out of that list of 190 odd countries, is sitting somewhere around 130. So not great. But when you look at that domain, the one about children's rights, we're well close to the bottom, 180 something. So almost one of the worst countries in the world when it comes to children's rights. And that's because of what's happening to trans kids. Because the underlying issue here is not about whether a child should be able to transition or not. The underlying principle here is whether a child is able to and has the competence to dictate their own future and their own healthcare. And what we're saying is no. Well, at least for these kids, no. And it's a slippery slope to doing that for other kids, right? So if we find that hormones are banned for under 18, which is what the lawyers are after, what this particular far-right evangelical Christian lawyer is after, the one who achieved the puberty blocker ban, he's the one going for hormones for under 18s, wants to get them banned. What then happens to hormones for cis girls under 18? Contraception, in other words. Do we ban that as well?
I suppose the question I keep asking myself, and this is probably the question that will haunt us for the next 10 to 15 years, I suppose, is how do we cut through the noise and sort of get this whole debate? Because I suppose I always struggled, and as a gay person, as a black person, I've been there multiple times, and people are always keen to debate other people's existence. So I suppose I struggle with the whole no debate thing, because Well, I think we need to talk.
We do.
We need because it won't go away by not talking. I think the big question is, how do we get this debate? At the moment, it's a shouting match, but how do we get this debate back on facts and lived experience and reality? Because it seems like it's so, I mean, we've been talking for 50 minutes. And this has been so interesting to hear, from, I've never talked to a GP before in that way, to hear about your experience, your lived experience, your professional view. And I feel like the public discourse couldn't be further away from what we have discussed.
I agree.
So how do we get this back on track?
It's really tough, isn't it? Because one of the things that trans people are constantly saying is that our voices are not being heard. And, obviously that's a particular issue for trans masculine people and older trans masculine people like myself. Because if you think about it, again, you have to put your goggles on, the ones that say trans people don't exist. So if you look at our hierarchy of patriarchy, I shouldn't be listened to because I'm female, not male. But worse than that, I'm a female who's gone mad. So I definitely shouldn't be listened to. So I think one of the problems we've got is because we are facing an issue of prejudicial thinking, discrimination, lack of understanding, lack of education, as with all civil rights movements, it's about educating people, and we can only just keep doing what we're doing. I've long accepted, Leslie, that I'm not going to see the turning point in this in my lifetime. I'm happy to be a foundation stone of something that I think is really, really important, which is the deconstruction of gender. I've always said the easiest route out of this is to stop doing gender, but we're not going to stop doing it anytime soon, right? It took us, we still do racism 250 years after abolishing slavery. If we just stop putting gender markers on people's records, and, if you didn't know what sex a child was when you met with them, and it was okay not to know, then they can find out for themselves whether they can cope with their puberty when they get there. And if they don't like things that are happening to their bodies and it's making them want to sit in their bedroom and cry if their voice breaks, then you give them something to stop their voice breaking until they do feel ready. And if they never feel ready, that's okay too. I just think the way we talk about our reproductive organs, it's like we're enslaved to this, and we don't have to be. And if anything, it's in queer circles that you realize that, because of the gender performative nature of what we see in from people who drag or cross dress, to people who do it more frequently, to people who've gone all the way to needing to take hormones because that just feels better, and finally, as I say, a small number of us who need surgeries because the imposition of what your body should be and look like is so hard rooted. I'm always fond of saying, if my mum had said to me when I was 3 and first started throwing tantrums about skirts and dresses, if my mum had said to me, that's okay, of course you're a boy, lots of boys don't have penises, then maybe, and that's what I would say to a young trans child today, you don't have to have these to be this, then my life might have been a bit different. But those of us who have been brought up in binary, strict and religious settings such as myself, we're the ones who maybe struggle the most. And don't get me wrong, I have no regrets about my personal journey, because it's opened my eyes to this horror, which is that we are allowing gender to harm bodies, and bodies are having to make changes to themselves in order to cope with that harm. So could we not just stop doing it? There was a time in the earlier part of this century when I first moved to Brighton that all new buildings were being given gender neutral toilets. That was my understanding anyway, which is great, because gender neutral toilets are always tidier, cleaner and more respectful spaces, like our ones at home. We've all been brought up with gender neutral toilets, haven't we?
Yes, and there are some places left. I think I recall the i360.
Yeah, maybe that's true.
They still have.
But you do find them in Brighton. It's always been a haven. But
You do
I think
find them, yeah.
the toilet thing, the bathroom ban, changing rooms, or trans athletes, however you want to look at it, when it comes down to this kind of intimate space and genitals, this fixation is horrific. I mean, it is absolutely horrific, and it is already having an impact, as you say. The guidance that's coming from the HRC is far overreaching as far as people are concerned. It's overstepping the mark. It should be scrutinised in Parliament, and it won't be. So we saw a little flush of it after the Supreme Court judgment, and we will see that unravelling over the next months and years. Unfortunately, it will drive trans people out of public spaces, and that's what's wanted, to either have us hide so that we're not seen, or have us not exist at all through suicide, which and the statistics again are poor, especially amongst young people.
I'd like to ask you about one more thing, something that's more and more debated because of the anticipation of the new code of practice. What's your take on third spaces?
Yeah, difficult, isn't it? Because that feels very dehumanizing in some ways, but it's also a neat solution in others. And to be fair, this is a merry-go-round. We've been here before. So back in the early 2010s, the bathroom ban, as we would call it, was happening in some of the southern states of the US. So we've seen this evolve over more than a decade. And even back then in this country, people were often being directed to disabled toilets or changing rooms as an alternative. I myself lost my gym membership over this because I said I need to use the male changing rooms, and they said you can't. And I said I can't go in the female. And they said, why don't you come back when you've finished? Finished what? Finished my transition. Extraordinary.
Did they really say when you finished?
Yeah, this was over a decade ago. In any event, we've been around this in circles. I mean, toilets have never been easy for many trans people. I'm a very confident, bold person and happily use the male toilets. I would never go into a female toilet, although I'd much prefer to. And if I'm forced to, I'll be happy because they are cleaner and you can chat in there without being called a faggot. So sorry, excuse the expletive, but it's not. Female toilets are actually largely nicer spaces, but I think. Why third spaces? Why not one space that we all use? Why not, dig hard into the reality of our commonality as humans being the only thing that really binds us? And if that's done in conjunction with compassionate listening, toilets are never and should never be dangerous spaces. I'm not in favour of a third space, but I also do understand, that progress has to be made slowly. And there are, we mentioned earlier, countries where you can have an X on your passport, for example. So the option in India have recognised a third sex for trans people. I don't think it's ideal. I think what's ideal is taking it all away in the first place. Just don't do it.
It's just one anecdote because, and I discussed this with a friend. It was the Pride Saturday, and we left the park after Mariah Carey gave a very lovely sort of played her show, finished up, and we went to a pub, and all pubs were absolutely full of people. And it was an amazing atmosphere. And unsurprisingly, the toilets were busy as hell. And when I tried to use the gents, which there weren't any gender-neutral toilets, the gents was full of ladies.
Well, this is the thing, isn't it?
Using the toilet as well. I was like, oh, that's interesting. So, in the moment of need, it doesn't really matter.
I always tell the story when I was a medical student in the 80s at St Thomas's Hospital in London. The student bar was on the first floor. The female toilets were one floor up or 2 floors down in the basement, and there was a male toilet at the same level as the bar. So so I never ever went anywhere else other than in that male toilet for the entire 5 years I was a medical student, because it was the quickest one and easiest one to go to when you were drinking in the bar. Why was I going to climb up a flight of stairs or down to? I think that, and as I said, we all use the same toilets at home. The toilet thing is extraordinary, and of course we mustn't fall into the down the rabbit hole of undermining women's rights. Women have a right to safe spaces, but trans women are not the threat. As many women are pointing out at the moment, the real threat in terms of sexual violence to women is cis men. The reality is cis men are a threat to women because of toxic masculinity, which is also a tool of oppression that we can accredit to gender. So, all of it's connected. And if we want to get out of this mess, we need to stop thinking in gender, stop thinking in binary, stop attributing so many things to our genital organs. They don't have that much power.
And you know what? You are bang on. And just the other day, I had another look at stats, data, reality, facts. Something that's sort of almost a forgotten thing nowadays. And you are right. I mean, the data is horrific when it comes to violence against women and girls, and that's primarily done by cis men. And then have another look at the stats when it comes to especially white cis men and the rate of suicide.
Yeah.
So there is something that's like a service
gap there
almost. There is a lot going on, and I think we shouldn't be too distracted by, and that's my personal take, people are happy to disagree with me.
I think that's absolutely right.
Proxy wars.
The youngest... Sorry, I interrupted you. That was you made me think of the youngest of my three kids, who's a 20-year-old male, and he's very, very aware that the actual body he occupies in the world is a really hated body, and that's not healthy either, and that's how young men and boys get radicalized, because they feel that hatred. And I think it's really important to understand that we do collectively feel what's in the ether, right? So you, as a gay man, would have felt what was in the ether in your younger years, and still do now, and I do as a trans person. So it doesn't have to affect me personally for me to feel laden by it, burdened by it. This is why young trans kids are dying, because they feel the burden of hatred towards them.
Absolutely. Sam, it's been a tough conversation, but I'm glad we did take the time to talk through all of this, because I think the more we talk about the things that really matter, hopefully some of that will get in the right channels and bring people on board, because as a broader LGBTQ community, we need all the allies we can
absolutely
get.
do. And I know it's really disappointing that there are lots of people in the LGBT community who really can't see the truth of this, and how dangerous things are right now for trans people in this country. As I mentioned earlier, I think we are farther along than we think we are. So I think it's going to kind of snowball quite quickly. And we need our own language for what's happening. We're feeling it as being disappeared. I feel disappeared from my job. I was cut loose without an income, and cut away from my cohort of patients in an attempt by the NHS to shut down this model of care that we've spent 5 years curating and building up carefully. It's a safe space for so many patients and is growing all the time, and it's being literally, the service has been beheaded because I'm not there, and so many other things are going on. It's just a microcosm what's going on in Sussex, but it's realising that trans healthcare can happen on the ground, close to home, by your GP if they want to. The reason they're not doing it is that they don't. The NHS is not safe for trans people. And as we saw in the AIDS crisis, there was a response. Our entire sexual health network grew out of the failure of a mainstream health service to deal with gay men respectfully and compassionately. And I think something else is going to happen now because of this. It's not a safe place for us anymore in the NHS. That's very sad. But that's indicative of the denial of rights. If your only healthcare service can't actually look after you, then you're not being treated as humans.
That's right, and I mean, we're just about to start this journey, and we don't know what the code of practice again sort of initiates in terms of domino effects. So we will have to wait and see. But hopefully, this won't be the last conversation, and you're always welcome back. So thank you so much for your time. And,
it's been a pleasure. Thank you.
Good luck with everything. Thank you to Sam for sharing his story on Political by Design. You can find more reporting about his work and the wider debate on trans healthcare on Scene Magazine's website, which is linked below. If you found this episode useful, please share and rate and subscribe. That would be really, really helpful. I'm Leslie Clarke, and until next time, keep questioning how politics is designed.